So welcome everybody for a new podcast episode Ocular Insider. And I'm today in Italy in a very beautiful place of Lamezia in a key hotel with my two special guests, and they participate in a nice dry eye symposia and a congresso, which is the very interesting name, the part of the universe of dry eye. And please let me to introduce one of my friends today, Liliana Nóbrega from Brazil, the beautiful lady, the doctor, and that has a long history and also been in the dry eye sector already, having very interesting journey. And she's a founder of the nice eye clinic in Espírito Santo in the state of Vitória. And thank you, Liliana, be our friend for a long time and also our supporter. And nevertheless, the pioneer of the IPL and intensive pulse light therapy for dry eye, Dr. Luca Vigo from the Valia Clinic, Milano. So Luca has been in this industry for a long time and having a lot of very interesting approaches, and his new therapies or protocols are used across all around the world. And I will be discussing today about a very interesting subject. So I hope that all of you will enjoy and having fun to listening, maybe in the car, on Spotify or on YouTube. So welcome, Liliana, Luca.
Thank you very much, Peter. Thank you.
So in this podcast is generally generated to be a dry eye podcast. But I want to also introduce interesting people with their nice history, nice story to tell. So I'm very happy to have you, Liliana, and you, Luca, because I'm sure that you have a beautiful insights that could also be interesting for auditions. So my first question that would be the same to you, Liliana and Luca. What makes you convinced to concentrate on a dry eye as a topic for your, professional career, Liliana?
Thank you, Peter, for this invitation to be a guest in the podcast. Well, answering to your question, I began studying dry eye when I was in my fellowship in Brazil in upper plastic surgery. This is when I started studying dry eye. It was in 2001, so it's been 24 years by now studying dry eye disease. And I didn't stop. After finishing my fellowship, I returned to my hometown in Vitória, capital of Espírito Santo, in the southeast of Brazil, and I start my private practice and at the university dealing with patients suffering from dry eye disease. There was no doctor, no ophthalmologist in my city that was dedicating time for dry eye disease. So I started my practicing patients and developing a relationship with other doctors, such as rheumatologists and other ophthalmologists, making reports, seeing the patients, follow up the patients. And I noticed that dry eye would be a very important disease in the future. So I started dedicating part of my studies in this field.
Mm-hmm. So it's interesting how you focus from beginning.
Yeah.
So it was the same for you?
No, it was not the same. It was not the same. I've been focusing about dry eye for about 10 years because I do a lot of refractive surgeries and cataract surgeries, and some years ago, 10 years ago, we found that many patients were happy as regards the visual outcomes in terms of plane or refractive error, so very good results, but complained for something else that was correlated to something related to the ocular surface, so related to dry eye. So in that occasion, I decided to focus on dry eye because I had a friend that in the United States used the intense pulse light just to treat this kind of patients. And I decided to do the same in Europe, especially in Italy where I live. And so since then, I decided to use, of course, the IRPL treatment. This story is very, very long, and so now I don't want to bother you about this.
Yeah,
but
part of it yesterday through your presentation.
Yes, it was. And so I think that from then I decided to focus on dry eye. I decided to diagnose the dry eye patient, to screen a dry eye patient before treating these patients with cataract surgery or refractive surgeries, and also to treat, of course, all kind of dry eye patients that suffer from moderate or severe dry eye, because you know that the frequency of dry eye is very, very high, also in Italy, and I think that in all the world, I think. And so because of this, because of the correlation of cataract and refractive surgery, I decided to focus on dry eye.
Yeah, it's interesting, the two different worlds coming to the one pot. And now with you, with a direct focus on beginning, seeing this would be the rising star in the future, and we look at from side of the needs of the customers. So as I see that this year is the one of the biggest challenge, and I think you may agree with me, and would be very nice to hear your objective. The education is the key for success in everything what we do. So Liliana, I know that you start already with your education, very interesting school, dry eye. So how is your personal experience in this field?
Peter, since the beginning of my studies in dry eye, I try to educate not just our patients about what is dry eye and how severe it can be and affect the quality of life and the quality of vision of our patients. But I also try to educate the doctors, especially in my city, in my state, all over the country of Brazil. Right now, we have a contribution also with Ophthalmology University, with Andres Benatti, and we can also teach some lectures, some classes to countries all over Latin America that speak Spanish, and we can also teach those doctors that want to learn about the ocular surface, that want to learn how to manage a dry eye patient. And also in Europe, when we come to ESCRS, and we can teach doctors with our experience from all parts of the world in Europe. And so we developed also in Brazil. I launched last year online course about dry eye disease. It has 7 hours of recorded lectures about dry eye, and we are little by little spreading this information all over the country, all over Latin America, maybe to the world, with our experience and practice in how manage dry eye disease.
When I see this and then you do this education, what do you see as the hardest part to let's say educate or convince young doctors start with the ocular surface, treatment or screening, like Luca said? What is the most complicated for these doctors to start this kind of job?
I think the doctors, mainly ophthalmologists, they, in the first years of practice, I think Luca will agree with me, they focus on ocular surgeries. They focus especially on cataract, refractive surgery, or blepharoplastic, for example, or retina or glaucoma practice. They are not worried about the ocular surface. But what we see in our offices today, it's an increased number of dry eye patients. So it's the second most prevalent disease in our offices right now. Mm-hmm. So that's what I wanted the young generation to focus and to pay attention that the results, the outcomes of the ocular surgeries will be affected if they don't treat the ocular surface previously. So that's the main message that we want to pass through the younger generation. Pay attention to the ocular surface, pay attention to dry eye disease, which is a disease that affects all the results. So we invest a lot in cataract surgery, refractive surgery, a lot of money in equipment, in diagnosis and equipment at the hospital to perform excellent surgery, and we can't put this result down if we don't pay attention to the ocular surface.
Great. That's always nice to hear that the knowledge you're sharing. And I definitely have to agree, even with my small experiences from this field, when the multifocal lens is launched into the early 2000, when the global companies launch these products, and we see that patients 2020 unhappy. And everybody was talking about it's adaptation time. It may take a little bit more or longer, and it's great to see that our knowledge increase. So we now are able to deliver much better care. So in these regards, I'm very happy that you, Luca, you are part of the beautiful education and our system in Italy, that you're sharing your knowledge. So, and with Giovanni Tedesco, you start already this year is the fourth season of the Congress of Dry Eye Universe. So tell us, what was behind your idea? How you and Giovanni and Rolando Toyo, I should not forget that. Come to this beautiful place that you will be organizing this more like a advanced level for doctors.
But because we decided to do this because we think that everybody must be aware about dry eye, and dry eye disease is a disease worldwide, very frequent, and I think that ophthalmologists don't lose time in taking care of dry eye patients, but it's very, very important. This is what I was saying, what also Liliana said before about the fact that if we wanted to achieve very good results, especially in cataract surgery with premium IOLs or in refractive surgery, we need to take care of ocular surface and, of course, dry eye, because otherwise we can get good results in terms of emetropia, but the patient can complain for symptoms that sometimes are really severe. So that's the reason why. And so we decided to do this kind of this meeting, this international meeting, because we think that it's very important that everybody must know how important is dry eye in his job, in his daily routine, because we can visit every day patients that are complaining for dry eye, and we can visit every day patients that are asking for surgery, premium surgeries. And we must, and also the patient know now that dry eye is a disease and they can suffer from dry eye, and we must take care of this before doing anything else. And so that's the reason why we need to know something more during these kind of meetings in Italy, but also everywhere in the world, because Liliana does the same in Brazil, and Andres Benati does the same in Argentina, Rolando Toyos in the United States, and so on. And so I think that this is the reason why, why it is so important doing this, and I hope that we will go on in organizing such important meetings also in the next years.
Yeah, would I like it that the Congress become more and more international?
Yeah, I would like.
It's really also now we see also the doctors attending from North Africa, from Algeria, from Morocco.
Yeah.
So I see that it's becoming more and more interesting. I think it's also due to God that you coming and sharing the knowledge, and I think that one of the topics that resonate during these days, how interesting ocular surface disease is, how multifactorial, and so what do you think is the biggest factor these years that change the discussion about the dry eye and ocular surface health?
Well, I think there are many risk factors, Peter. But after COVID, we have digital transformation of in a modern lifestyle. We have been living a modern lifestyle in front of the screens all the time, in front of the cell phones, tablets, computers, notebooks, TVs. We have changed our diet.
Yeah.
We have different air. We have air pollution in biggest cities, especially. We have also our modern surgeries, ocular surgeries that affect the ocular surface. We have aesthetic procedures.
Okay.
Yeah.
We have makeup. We have contact lenses. We have medications that are usually needed for the majority of the population, such as antidepressive, hypertensive medications that affect the tear film. So those are all risk factors for dry eye disease. So we have been diagnosing much more dry eye in our offices each day. So there are many risk factors. It's a multifactorial disease that affects the tear film and the ocular surface.
Yeah, completely agree with you, Liliana. Completely agree with you. We change the way to live, the way our mood sometimes respect to the past. Mm-hmm. And so I think that this is probably the main reason for this increasing number of dry eye patients that we face today and probably in the future. So
expectation from the life, having health.
Yeah.
This would be and it's now and will be the game changer. I think
absolutely.
All medical care.
Absolutely.
So as the vision is one of the key health topics for us, and to see the world is the way we communicate. I believe people who really suffer on a dry eye, or those who will be healed, definitely should learn more how we can make a progress. So, do you have any, like a suggestion for the population that they should do, that will be aware, how they can extend the healthy life?
Yes, definitely. They should change a little bit the lifestyle. We can't make pauses in front of the screen, use the screen less than 6 hours a day, for example. Okay. Sleep better, eat better.
Yes.
Hydration is important too. So we must take care of our eyes in a daily routine. So you should visit your ophthalmologist, you should listen to your ophthalmologist, change your lifestyle, change your habits, take your medications as prescribed. So this is important. This is important for the population to be aware of dry eye. Mm-hmm. This is a disease now that affects 12% of the Brazilian population, 24% of the population of São Paulo, which is the biggest city in my country, and 23% of the young population at the universities, Luca and Peters. So it's a huge problem right now. So the population must be aware of dry eye and take care of their own health.
Mm.
That's great. It means like we need to love ourselves much more.
Yes, of course.
You need to be confident that you want to have a better life. So I know that Tavalia and Carone's clinic been always something special in Milan, and Italy been always one of the top countries living healthy life. So how it is Italy?
I think it's the same, because sometimes we cannot prevent the onset of dry eye, because we said that now the life is completely different from the past, and so it's very difficult to decrease the number of patients that are suffering from dry eye, because menopause is for every woman in the world and can cause dry eye. So it's very difficult to prevent for everybody, but we can prevent that the symptoms must be very, very severe. And so that's the reason why probably they can follow our suggestions, our advices, being doctors, being involved in this field, particular field of ophthalmology. And so if we give the good suggestions, I think that our patient must be maybe happy and not complain very much about dry eye. So I think dry eye will be a disease forever now. It's impossible to change this, but we can manage very well this disease, and we can allow patients to feel better.
Great. Thank you so much. I know that would be even more and more secret from the new, very genius guy to come in dry, and we will definitely continue. So I will keep some more insights for the next episodes, and I think the next one, hopefully, we can shoot in Copenhagen.
Oh, very good.
Yeah.
So for sure,
maybe we can go more deeply.
Okay.
Definitely, I know that you have a lot of in your shelf as well, with the new protocols we're preparing for the new treatment. Liliana with the side of how to manage the patient through the clinic. So I would definitely invite you for a new episode with Liliana Nóbrega and also with Luca Vigo.
Very good.
So it was a great to have this today here. I know that we could speak longer, but the sessions of Congress start soon.
In 3 minutes. In 3 minutes we have to move.
More. So thank you so much for
Thank you very much. Thank you.
Thanks to all
you
who listen on Spotify. So stay tuned for the new episode. I think will come soon. So have a great day.
Thank you very much.
Thank you.
Bye.
Bye.